Hey, I wanted to talk a little bit with you about spasticity and tone. Those are a lot of questions that we get asked about, and I wanted to talk to you a little bit about it. And so let's just talk a little bit about how your brain works typically. So this is a model that I drew, and it's pretty basic, but you have your brain and your spinal cord. And then off your spinal cord, you have nerves that go to parts of your body. So we're going to talk about, let's say, the muscles that bend your elbow. When you are functioning, there's some degree of signal that comes from your brain to these parts all the time. And so that's generally what people consider muscle tone. So you have some sort of tone in your muscle at all times. And you can sort of think of it as a volume knob. That's how it was described to me, and that's what I like to use to describe to other people. So there's always some low level of volume on that your brain is sending to your muscles. When you've had a stroke, you might have a change in the volume of signal that's coming from your brain to those muscles, because you've had some damage in an area of your brain that may be responsible for controlling those particular muscles. And so you may get a lot of signal coming down into, from the brain into the spinal cord, into the nerves that would tell those muscles to tighten. And that may be when you experience that spasticity. That volume knob has been turned up on the signals that are going there. And one thing that some folks choose to do to try to manage this situation is to get Botox injections into those muscles that may be a little bit tight. And just to talk a little bit about how that works. So this signal that comes down from your brain to your muscles is electrical. It's an electrical type of system. Right at the very end of the trip, where the muscle or where the nerve fiber communicates with the muscle fiber, there's a junction. There's a space. It's called a synapse. And so I have a really gorgeous picture that I keep up where I work with stroke survivors. We're going to draw just a simple diagram here. So it really is just sort of an ending, okay, that has a little bit of a space in there. So the signal is going to come down, that electrical signal, and right here it's going to trigger a chemical signal to travel across that space. So little chemicals head here to set off a little signal on the other side to tell that muscle to tighten. If somebody were to get a Botox injection, what happens is that Botox actually works right here to stop the chemicals from coming from one side of this junction to the other. So when we think about what's happening, the signal in the brain hasn't changed. The volume is still up. Lots of signals are coming down. And if you have a Botox injection, the Botox just stops that signal from traversing all the way across to make the muscle contract. So when we work with folks who choose to go through the process of having Botox injections for a tight muscle, I am sure to have a two-prong approach in place, and that is that there is a plan for stretching that muscle that was targeted, and also a plan for changing the volume of that signal that's coming from the brain. So increasing the volume of the signal of the opposite side. So if we're talking about the muscles that bend your arm, we would want to be working on a plan for stretching those muscles, turning up the volume on the straightening muscles, and also turning down the volume on the bending muscles. So we really want to work on neuroplasticity in the brain for making a change in this body part. And the way that I look at Botox, the way that through my training I've come to look at it, is this is simply a window, because the effects of this medication in this junction last only a finite period of time. And it may be different for different folks, a period of weeks, up to typically 3 months that you may have the benefit of this zigzag line doing its job. And so in that time, when I work with folks, what we do is try to make a change up here in the signal that is going to those muscles. And again, working on trying to change the volume on the muscles that are tight, and then the muscles that work on the opposite side of that muscle group. So that's a little bit of an overview about spasticity and tone, and maybe one of the options that people choose to try to address that. All right. If you have any questions, what you can do is just simply send me an email, ask away, and I'm happy to answer your questions.